Having a lot of neck pain lately? It could be caused by your smartphone. To find out why, I sat down with spine specialist Dr. Jose Mena.
The reason that the posture might be really important is because if you start going in this way here, when you're sitting, when you're looking at texts, phones, etc., you're putting some strain on the disc and the joints in the neck, and that can eventually lead you into having other problems. So eventually they will degenerate and they can compress the nerve, and then all of a sudden now you have arm pain, numbness, tingling. So the answer is yes.
Okay, but let's talk about that text neck, because I feel this is probably something new
that
you're seeing as well. We have a little video that explains a condition called text neck.
Text neck is a condition usually seen in younger people between the ages of 18 and 44. It's almost actually at an epidemic proportion. Up to 79 or 80% of individuals in that age range have difficulty with neck pain. And they found when they look at the behaviors of those individuals is that they bring their head forward when they're texting, and they could text from 2 to 4 hours a day. Not all constantly, although some for more than 1 hour. And if I can show this position, they're in their phones like this with their neck bent about 60 degrees forward. And they're looking down the whole time, and before they know it, they have neck pain. We found that it's attributed, in many cases, to our high-tech world right now, whether it be a computer, a tablet, or a smartphone device. Complaints of patients with text neck is usually neck pain that's non-radiating in the back of their neck and up to the shoulders usually. They have shoulder pain and stiffness in their shoulder. So we want to try to make the device at eye level. Secondly, we want to try to limit the time they're in that position. So we want to have them take more frequent breaks. I know we're not going to curtail the habits of texting in this day and age and using the computers for extended periods of time, but it's important to break some of the habits, change position, have them take a break, and get up and walk around and then come back to it, so now they start to stretch. And then I often give them exercises to supplement that.
That's good advice from Dr. Tolchin right there. But is most neck pain due to muscle strain?
There's a combination there. Muscle strain might be related to it. Most of the time, the vast majority of the patient is related to a joint problem in the neck called the facet or sacrophyseal joints. That's the most common one, between 5th and 6th vertebra. That's where the money is, or the 2nd and 3rd vertebra in the neck. So that will be causing more headaches, and the C5, C6 normally tends to cause more pain in the trapezius area.
Okay, so let's do a demo. Take your phone, and I'll take mine.
Okay.
And you're gonna show our viewers the proper way to hold a cell phone.
Proper way will be like this.
Here, like this. Because this is no.
Correct.
Okay, I was just doing that. So.
There we go.
Okay.
There you go.
That helps, correct? Keep the muscles in check?
Yep,
Okay.
actually keeps the alignment on the spine, so that's what we want.
Because what happens over time if you keep doing this?
You keep doing that, you're normally aging. There's already is a given. So now the aging, already those discs, those joints are a little more degenerated, and now they're more prone, more susceptible into further injuries, and that's typically what tends to happen.
So when should someone see a doctor if they have neck pain?
It depends. If they have neurological deficits, definitely, or symptoms going in the arm, numbness and tingling, that's something that they need to be seeing quite quick. But if they are having just a soreness there, that's something that can be managed a lot of time with posture, doing some exercises for the neck, and taking some over-the-counter medications. But if that persists, then that's the time to start seeing someone.
So let's say if you have a stiff neck, though, is that something that can also be treatable? Or, I mean, can most neck pain be treatable?
Yeah, absolutely. Most of the neck problems, they can be treated. But if someone has a stiff neck, it might warrant some evaluation first.
Okay.
Make sure that everything looks fine anatomically. Most of the time, might be either a newly developed disc herniation or a joint problem. But some people, advanced arthritis, that can limit the rotation of the neck. Or there's even a condition called DISH, D-I-S-H, that normally there's a lot of spurs that is connecting among the different joints, and those patients normally there's a very limited range of motion.
What about patients who do this? Cracking their neck.
Cracking the neck, that's nothing
not bad?
nothing bad.
Okay.
Typically, there's as part of the degenerative process, there's some bubbles that they form in there in the neck from nitrogen. That normally is a byproduct of degeneration, and what you're doing is you're just popping those nitrogen bubble out, so nothing to be worried about.
Okay. Now, we want to remind our viewers that there is still time to call in if you have a question for Dr. Mena. Pick up that phone. It's 855-796-4475. We would love to hear from you. So what are some tips to avoid neck pain?
Normally, keep maintaining a good posture, so try to avoid slouching or rounding your shoulders, those things that they will typically will deviate the alignment away from it will change the alignment. So those are things that will put more stress on the joints, the disc, and that can be a source of problem. Keeping a healthy weight, doing an exercise program, those are key things as well to do.
But what if, unfortunately, you are a patient that may need surgery? What kind of patient are we talking about here?
Okay, typically for patients to have surgery, there's most of the time are two main ones. Will be either A, that they have symptoms going on their arm, numbness and tingling, that they are not responsive to conservative treatment, so meaning physical therapy and/or injections, medications, and there's a lesion, that there's something there that is causing an anatomical cause. Those patients might be a suitable candidate for surgery. Other patients that they might be surgical candidates will be people that they already have a big disc herniation, is compressing the spinal cord. That's definitely that's a given. Also tumors that they found incidentally that might be compressing a nerve. That's something that might be surgically related.
And I think we can all use a little help with our posture. So if you want any tips, we've got them. Download the Health Channel app. That does it for us today, along with checking out our website. Be sure to follow us on social media. We're on Facebook, Instagram, and Twitter. We're everywhere at All Health TV. Thank you for watching the Health Insiders on the Health Channel. I'm Kathy Buccio. We'll see you next time.